I'm Dr. Liz Suffett. This is my dog Lewis. He's about 10 years old, and we're sitting here in my kitchen because I want to show you how I recommend people work on their dogs, keeping their dogs' teeth clean at home. It is a vitally important part of dog home health care, and actually the technique I'm going to show you can be used on cats too. It's really quite simple because I found that if things aren't simple and easy, they tend not to happen. The very first part is getting an idea of how easygoing your dog is about having their face handled. Lewis really loves his face being rubbed. Many dogs do. If you're starting with a puppy, just take it slow and easy. An older dog, really the same thing. The first part of it is finding a time of day that you can be relatively consistent day after day. For us, it's after I finish the dinner dishes. I call the dogs over to me, they get some cuddles, they get a little treat, and I quickly do their teeth, they get another cuddle and treat, and we're done. So for the first week or two, depending on how easygoing your dog is, what I would suggest is that you call your dog over, give them a little treat so they're used to, oh, this is just a new treat time, and spend a few minutes just rubbing their face like this. And on the outside of their cheeks, under their eyes, maybe over their head, and tell them what a good, wonderful boy he is. He's such a good dog. And do this for just a few minutes. Give them a little treat, a little cuddle, and you're on your way. So for those first 2 weeks, what you're getting your dog used to is having his face handled and getting you and the dog also both used to the routine. After those first 2 weeks, when your dog's pretty compliant with this, what I recommend is using a simple gauze square. You can get these at the pharmacy in big packages. They also make little, at pet food stores, little silicone or plastic nubbin type things to fit over your finger that you can use. You can moisten it. You can use a little bit of the dog toothpaste that we have at Pleasanton Veterinary Hospital, or you can even use it dry. If all else fails, you can even use an old washcloth that you launder and keep clean. So when your dog is used to you coming over, what you're going to do is wrap that around whatever dominant hand, I wrap it around my index finger, and I start just gently lifting Lewis's lip. And you can see he's not thrilled about it, but it's really not that big a deal. The important part is reaching these back cheek teeth, especially on the upper side. If you can do the lowers, that's great. The thing that I particularly like about doing this technique is that it avoids sticking something big and hard like a toothbrush in the dog's mouth. Some dogs will accept it, but many won't. And if it becomes a difficult procedure or painful for you or the dog, it's not going to happen. And I want it to happen. So using the gauze, again, just lifting their lips, rubbing it across the front teeth, and reaching back here. The other beauty of this technique is that you don't have to be down there looking at the dog's mouth or cranking it open. They don't like it, and it makes it more challenging because your finger is telling you where you are in the dog's mouth. You just continue to rub like this, back and forth, around the tooth and gum margin. Give the dog another treat. Tell him what a wonderful boy he is. And you're set. You can wipe down a lot of plaque and food particles before they turn into tartar on your dog's teeth, which can create gum disease and tooth infection. Call us if you have any questions or problems at Pleasanton Veterinary Hospital, and we will gladly go over this to individualize it with you or your dog and your cat. The thing to do is keep it simple, keep it fun, make sure that both you and the dog have some reward for it, and ultimately the best reward will be having dogs that have good, clean teeth that last them a lifetime. Thank you.